Hey everybody, welcome back. Welcome back to my channel. All right, so I want to go ahead and get into today's topic. So as y'all know, I'm Simone Taylor, and I'm a therapist here in the Houston area, and I'm coming in here to share relatable, healing, educational, informative insights all about therapy, okay? So let's get started. Today's topic is going to be about the levels of care when it comes to mental health or mental health therapy. So I kind of mentioned briefly in my first introductory video that y'all can check out about how there's kind of layers to therapy. So you have your short term and you have your long term options. Well, let's get into those options today because fortunately I have been able to experience all different levels of care. So let's get into it. Okay, so numero uno, number one, the first level of care is going to be inpatient. This level of care is where you have acute patients or acute individuals that are experiencing crisis. So what does that mean? Acute, that means that they're experiencing such a high level of crisis that they need to be monitored 24 hours a day in order to ensure safety and stabilization. Okay, so this level of care is the top one because it's usually going to be in some type of secured environment, secured facility, usually in a hospital setting or somewhere like that where you have a facility that is fully staffed, or let's just say has staff, right? And you're going to have a treatment team associated as part of that staff. So what that means, a treatment team is what helps every professional individual that helps that patient to get through that crisis and be able to remain safe and also stabilize. Okay, so when you have treatment team, you're going to have a treatment plan, and that goes towards the therapeutic side. So the treatment plan is what the treatment team and mainly the therapist comes up with, where you're actually going to have a plan of care while that person is in that facility, in order to treat them and help their individual needs. Okay, so I know I said a lot, but that is just kind of the gist of what is happening at this level of care. Number two, you have residential. So residential level of care is pretty much a step down from inpatient, or can be sometimes. Maybe some people start at that level. They may not need to be inpatient, but they may need residential. Usually in residential level of care, you go to a treatment center. So usually it's a facility or it's a center. Sometimes it's homes, where you stay for maybe 30 days or more. So it's more on the long-term end. I forgot to mention earlier when we talked about inpatient. Inpatient is more short-term, okay? So short-term meaning less than 30 days, whereas long-term is more than 30 days or more, okay? But residential is usually on the long-term end, and you're dealing with the same kind of structure. Like you're starting to get that treatment plan. You have a treatment team as well at that level of care, and it's very similar to inpatient, where you have to stay at the facility, you're being monitored, and you're also being treated to get back stable, or you're remaining safe in staff's care. But the main differences between inpatient and residential is inpatient may be more short term, and residential is a more long term form of care. Okay, so one thing that I'll add is usually with inpatient level of care and usually with both inpatient level of care and residential level of care, you're looking at a similar treatment team setup. So with treatment team, generally it will be a psychiatrist, you'll have a therapist, you'll have a nurse, you'll have a nurse practitioner at times, you'll have a medical doctor or physician, you'll have tech staff, and I'm trying to see if I'm leaving anyone out. Maybe a dietitian as well, or nutritionist. So you'll have a whole team of staff to really be able to treat you and support your individual needs. Okay, so at both of those level of care, regardless if it's short term or more long term, you should have both. Okay, so the next level of care, number 3, let's get into it. Number 3 is kind of like the step down from either inpatient or residential, and you're going to go to PHP, which is an acronym that is for partial hospitalization programming. So I know that's a lot to kind of think about, but basically that's why we call it PHP. Okay, so let's get into what this level of care means. All right, so number 3, when you get to PHP and you get into partial hospitalization programming, you're usually going to go commute to the center or facility and do day programming. So essentially, you're going to be there maybe Monday through Friday. Some programs are Monday through Saturday, and you're going to be there from anywhere from 6 to 8 hours a day. And usually you're getting the same kind of intensity on treatment, right? Like you still have that treatment team approach, and you also have a treatment plan, but you get to go home at the end of the day. Okay, so it's just day programming. It's not 24 hours a day, and you're still getting support, right? But you are kind of exercising more independence, and you're trying to practice a lot of those skills that you've been learning from your treatment on the outside. So you get to go back to your day-to-day life. Okay, so PHP is going to be a step down, or sometimes it's a startup for some people that doesn't really meet criteria to be inpatient or in a residential level of care, but they still need a lot of support. So PHP will be a great option. Let's talk about IOP, which is another acronym. This will be level of care number 4. Okay, so IOP stands for Intensive Outpatient Programming, and essentially that is where you go to a center or a facility as well, and you're going to commute, but you go there for less amount of time. Okay, so you're probably going to show up to IOP maybe 3 to 5 days out of the week. So it may be instead of going Monday through Friday, you may only have to come Monday through Wednesday, or every other day. But it's usually shorter times that you have to spend at the center, but you're still getting that support from your treatment team, right? But and you're still getting structure to your day, and you're also only going to be there, so instead of it being 6 to 8 hours, you're probably going to do 4 hours a day at IOP. So it's a shorter time that you have to stay at the center or facility, but you're still getting programming, you're still getting structure to your day. And that means that it's more time that you get to go out and practice the skills that you've been learning in your treatment on your own. Okay, so you have way more independence for IOP. So this may be a great option for individuals that need more support than just our next level of care that we're going to be talking about, which is individual therapy, but needs more support than that, but doesn't really meet the criteria to come for a longer period of time with some of the higher level of cares. Okay, so with that being said, let's move into our 5th level of care, which is going to be with outpatient providers and seeing them more independently, which maybe some of you are familiar with. That's both with individual therapy, seeing your outpatient psychiatrist if you need one or have one, and also seeing a physician on your own as well to keep up with your labs and everything like that. Okay, let's get into it. Number 5. All right, so let's talk about number 5, our last level of care. This is going to be where you see outpatient providers independently on your own. Okay, so if you go to a center or facility, it's probably going to be where your therapist is located or where your psychiatrist is located, but everything is independently. You're going to make your appointments. Most people, or most times, it's set up structured to be weekly, so go once a week, but you could do it twice a week. You could do appointments once a month. So yes, at this level of care, you're seeing providers on your own time, and you're also presenting with more stable mood, although you still need support. Okay, so you can see your psychiatrist, a physician, or a therapist all on your own. Okay, so those are the 5 level of cares that I've all had experience with, and I wanted to educate y'all on what they were and kind of what is involved in them. So if you feel like it's appropriate for you to try one of them out, feel free to research and find resources in your area. I hope this video has been helpful for y'all. If you have any questions, feel free to comment below. I'll be sure to answer any questions that y'all may have about the levels of care. And I'm going to continue sharing content with y'all. Now, before this video ends, I want to share an affirmation that I found helpful for myself today. So I just kind of want to put it out there. And so the affirmation is, my mind has unlimited power. Okay, so I wanted to share that with y'all. Thank you for watching this video. I'll see you on the next one. Y'all have a good one. Bye.